Nicholas Skala helped draft Illinois House Bill 311, which is the Illinois version of single-payer health care. He was an officer with Physicians for a National Health Program, and he helped found Illinois Healthcare for America Now. Please welcome Nicholas Skala.
Thank you. Thank you so much. What a historic day, not just for Illinois certainly, but for the nation in terms of the single-payer debate that we're having right now. Was anybody here in Washington over on Thursday for the single-payer rally that happened there? A few of you? I was out there. It was led by Healthcare Now, by Congressman Dennis Kucinich, by Congressman John Conyers. We had more than 1,000 people turn out in Upper Senate Park to demand single-payer national health insurance, H.R. 676, and not the kind of stuff that we're currently seeing coming out of the administration. And it's certainly a historic day in Illinois. To tell you something personal, in my previous incarnation, as was mentioned, was a senior policy research associate for Physicians for a National Health Program, and a lot of my job was giving very dry academic talks to doctors. You know, sometimes conservative docs would chase me out of the room, but it was very stale. And to see all those people gathered there, and to see all these people gathered here today, doctors, patients, nurses, people who are concerned about the patients, who are concerned about society at large, who are concerned about other people, is something that always has and continues to touch my heart. It's very special to me. But I want to tell you very quickly about what's been going on here in Illinois. A lot of you know it already, a little bit about Healthcare for All Illinois and the single-payer movement here. Healthcare for All Illinois is a coalition of doctor, nurse, disability, seniors, women's, other kinds of advocacy groups. We have more than 1,000 members and more than 600 doctors in addition to that on our membership rolls. And we work exclusively for single-payer state and national health insurance. And I was there at the beginning because I wrote the legislation, and it wasn't an idea that came from nowhere. As single-payer has a long history, but not in Illinois, and we decided, a group of us, that we needed a state single-payer bill. And let me tell you, at the time that we did that in 2006, the crowd that I see in front of me now here out in Aurora in the suburbs was certainly unimaginable, and what we'll call the establishment left really shirked us off. They sort of shrugged and rolled their eyes. We were told that single-payer wasn't politically feasible, that the bill that we had would never be in front of the legislature. Today, House Bill 311 has more co-sponsors than any other health reform plan in front of either chamber of the legislature. We were told when it was finally introduced that it would be a joke. It would be relegated to some obscure committee and would never see the light of day. And thanks to a woman who's going to be introduced shortly, for the second time that bill has come out of committee, reported favorably, due pass to the full Illinois House of Representatives. And we were told that people like we are now, that people like the insurance that they have, that they want to keep the kinds of coverage that they have, and that single-payer would never get any traction. And right now, the combined healthcare movement, Healthcare for All Illinois, the Illinois Single-Payer Coalition, the Chicago Single-Payer Action Network, combined has one of the largest and most activist bases of any healthcare group in Illinois. So this is really a movement, and we found that we can strike sparks anywhere. But I want to just, before I depart for the other speakers, want to give an acknowledgement to our legislative leaders, and in particular to the two of them that are here today, because single payer, although we all know that it's not a radical idea, seems like that much to the political establishment. And so when Dr. Quinton Young and I and Dr. Ida Hellender put together the first single payer bill, we were a little nervous to approach legislators about it. And there were two that we went to first, and they're here today. One is Representative Mike Boland, and the other is the chair of the Illinois Health Committee, Representative Mary Flowers. And I remember in particular my conversation with Mary Flowers, and we went to her. This shows my own lack of foresight and inadequacy of knowledge, and we went to her and we sort of timidly said, Representative Flowers, we have a solution for the healthcare crisis in Illinois, but we can't keep the insurance companies. We can't even regulate the insurance companies. The answer is getting rid of them altogether, and that's the only answer. And she sort of looked at me for this, what seemed to me to be a great pregnant moment, at which I was sure she was going to say, "You're crazy, get out of here," like most politicians, like most unions, like most of the liberal establishment did. And at the end of that pregnant moment, she leaned forward and looked at me and she said, "I know." And for that, she deserves a round of applause. And from that moment on, she has been a champion of single payer in the legislature, has never wavered and has never faltered in terms of her advocacy for it. And as many of you know, we had the Adequate Health Care Task Force, which went around Illinois, resulted in the Blagojevich Plan. And it was Mary's idea to have statewide hearings in as many legislative districts as we could. And I said, you know, I don't know if it's a good idea. We already had these hearings. We've already heard from a lot of people. And Mary said, this time it's about us. And I reflected on that, and I realized, yes, last time it was about the insurance companies. Last time it was about the drug and the insurance industry. Last time it was about the entrenched medical interests. She said, this time it's about the patients who can't get health care and are suffering and dying. This time it's about the business owners who have to choose between providing health care to their employees and going into the red. This time it's about the 18,000 Americans and 1,200 Illinoisans that die monthly in Illinois because of a lack of health care or non-insurance. This time it's about us, and this is what we're going to hear about tonight. Thank you very much.